So in this video, we're going to talk about ACL reconstruction. The ACL, which stands for the anterior cruciate ligament, is one of the strongest ligaments in the knee, and it attaches the femur, the thigh bone, to the tibia, the shin bone, and it prevents forward motions of the tibia on the femur and confers stability within the knee. Not everyone that has a torn ACL needs surgery. It's typically reserved for those that take part in a lot of pivoting sports or are very, very active and have symptoms of instability. So that could be the knee giving way on any simple daily routines or on playing sports. One of the other reasons for doing surgery is to prevent further injuries and further damage to the knee that typically can occur. The pathway typically is split into 3 stages. So the initial stage is called prehab, where patients undergo physiotherapy before even having surgery. The purpose is to regain the knee range of motion, reduce the swelling, and get the strength back in the knee. Then surgery occurs. Now, typically I perform minimally invasive surgery, and I take the hamstring tendons from the patient that is used as the graft to reconstruct the torn ligament. Typically the surgery is performed as a day case procedure. So if the operating list starts in the morning, you would come in an hour before the operation time. You get admitted onto the ward, get changed. You'll be seen by an anaesthetist, and then you'll be seen by myself, where we'll go through the whole process and sign the consent form. You'll be taken to theatre, the surgery will be performed, and then you'll wake up in recovery. It's typically done under general anaesthetic, but I put lots of local anaesthetic around the wound to numb the area and to give effective pain relief. You'll be then transferred to the ward, where you'll be seen by the physiotherapist, who will assess your gait pattern and how you walk. Usually after ACL surgery, you do not need to wear a knee brace, but if there are other structures that are damaged in the knee, such as the meniscus tear that needs to be repaired or other ligaments, then you may well have to have a brace, and we'll have that discussion before and after surgery. On the ward, the physiotherapist will supervise the brace wearing, and you would typically start off walking with 2 crutches and gradually over a period of a couple of weeks wean off them. I typically see my patients, or the ward will see the patient two weeks after the operation to remove any stitches. And again, you'll start physiotherapy in a supervised manner, and then I'll reassess you in about 6 weeks. Following ACL reconstruction, the rehabilitation is long. It requires supervised physiotherapy, and you fulfill one stage and there's a criteria-driven rehabilitation. Then you move on to the next stage. As you may well know, if footballers have an ACL injury, that's their season over, and then they start again the following season. And that's an indication of the rehabilitation. Most people don't really start running until at least 6 months afterwards. But that's not to say that you're going to be not doing any physical activities. That's really still important to do. All surgery carries risks. And whilst these can occur, they are incredibly rare. Infection rates are really low, less than 0.05%. Pain, swelling and stiffness is part of the course, but actually with physiotherapy gets better. An ACL reconstruction is a highly successful operation with a success rate of 90 to 95%. So ACL injury can be quite serious, can be quite daunting, and can lead to pain, swelling and stiffness, as well as instability. It can be made better, and you can improve your function following ACL reconstruction.